So legendary rocker Jon Bon Jovi in the right place at the right time Tuesday when police say he and his team helped save a woman standing on the ledge of a Nashville bridge, and in a conversation that took less than a minute, that woman walked away. Now, in light of Suicide Awareness Month, we want to break the stigma of mental health. I'm now joined by Dr. Kenneth Rogers, who's a Vice President and Chief Medical Officer for Behavioral Health at WellSpan Health. Thank you so much for joining us, Doctor. Really appreciate your time.
Thanks for having me. Appreciate it.
So what did Jon Bon Jovi say or do that we could learn from? How do we equip ourselves with the right language in a non-threatening way to show up for someone who's struggling with negative thoughts?
Absolutely. It's a great question. One of the things that I think is important to know is that most people who are having suicidal thoughts usually will share those suicidal thoughts with at least one person prior to actually trying to harm themselves. And so one of the things that I think is important is to, one, listen carefully to what the person is saying. And then secondly, to be able to provide support in that particular time period. Support may look like, one, pointing out kind of the things that are positive in their lives. So if it's somebody you know, whether it's kids, their family, their job, things that are important to them, identifying those things and pointing out reasons to live. Also pointing out the consequences of death, which oftentimes is an impulsive act. But people often look and feel overwhelmed by the things that are going on. And so sometimes pointing out the ways that they may be able to solve some of the problems that are happening kind of in real time. When you're depressed, sometimes you're not able to clearly identify and think through issues. And so just offering a chance to give the person a chance to talk through things and feel safe in doing that.
Yeah, and that's very helpful, doctor. So CDC says suicide is one of the leading causes of death in the United States. It's alarming, but it's also so sad because when we have a physical problem, like we can just say, my arm hurts, my head hurts, and we know what to say or do. But for someone who's experiencing suicidal thoughts, how does that person feel comfortable enough to say, my heart hurts, my spirit hurts, so they can start having that conversation early on?
One of the things that I think became really clear during the pandemic is how important relationships and friendships are. Many of us feel isolated. And as we become more isolated, we don't really have anybody to have those conversations with. And so the main thing is, one, trying to have friends that are able to have those conversations, coworkers who are able to have those conversations and reach out. But also for an individual, folks around them just making them feel comfortable to be able to have a conversation of, I'm not okay, and that's okay. I'm here to listen. I'm here to talk through things. Because in most cases, it's not really about what we say. It's actually just about being there and just letting them know that there's another person around who cares.
Yeah, it's so important. And, like you've been saying, suicide, it's not a solution to a problem. Can you talk about the resources at WellSpan Health that's available right now?
Sure. One of the things I'll point out is 988 has actually become a big thing in this country. So 2 years ago, 988 became really powerful. But at WellSpan, we have, psychiatric providers in all of our emergency rooms across the entire WellSpan system. We have therapists in our EDs around the system. We also have crisis counselors that are in partnership between WellSpan and the counties in which we work. And so being able to reach out through 988, our local crisis line, I think is incredibly important. But again, knowing if you need help coming into a WellSpan emergency department, you're absolutely going to find the help that you need there as well with our psychiatrists and our trained master's level counselors who are on site.
All right, Dr. Rogers, thank you so much for being here, for your time. Really appreciate it.
Absolutely. Thanks for having me. Appreciate it.